So you have to make sure you find the right room. If you go to the wrong room and do the wrong patient, which means you didn't ID properly, you will get a big 0 because you didn't ID, you didn't look at the room. And before we go in, what do we have to do?
Check the
Check the
label.
door for
The door
any,
labels.
Signs.
what kind of signs? If there's any special PPEs you need to wear, so if somebody's got C. diff, you got a double glove, you got a mask up, you got to wear PPE. If somebody has tuberculosis, you got to wear,
A mask.
what kind of mask?
A shield.
N95.
N95.
Oh, yeah, what is it?
TB, you got to wear an N95. When you work in a hospital, basically they will, on your day of orientation, they will fit you for N95 because they come in different sizes. Okay, you have different size faces, so you got to have a right size N95 to fit. If you have the wrong size, you can contract the N95, the TB, because it's not fitting well. It's gonna go in. Okay, when you inhale. They have the N95 mask. Those ones that doesn't work for you, they have another special one, which is like a big tank, a helmet, has a tube on the back of it, and you have to carry a tank,
Oh, I've
a
seen those.
breathing tank. Okay, that fits all, but it's a pain because you have to carry all this tank and the tube and the big helmet.
Look like the alien from
Yeah.
Alien vs.
But
Predator.
usually the N95 works for everyone most of the time, I say. When I went on my orientation, none of them fitted me apparently. They were supposed to fit me again and they didn't do it. I had to go to work, I had to go in with the TB. I was so scared for my first time. But luckily, nothing happened. So I guess they fit. But anyway, you make sure those masks fit you properly. Okay, so I've noticed high risk fall. What does that mean?
Prone to falling.
This patient is prone to falling, so you gotta make sure if the bed is, usually the bed is low, but if the bed is high, you gotta put it down. If the bed rails are down, you gotta make sure they're up. But when we are working, we gotta make sure we put this down. I also noticed this.
I know.
Okay, this is not plugged in right now, but if it was plugged in, right here, what do I do? Anything I need to do?
Go to the other side.
Go to the other side first. If they have nothing on that side, we have to come back on this side. And what do I do now?
Distal.
Distal will go below. If there's nothing here also, they only have that one vein or where the IV is. What do you do?
Call the nurse.
Hi
Ask-
nurse, I'm just saying hi. Is that what you do?
You need to ask her to
Turn off the
turn off the IV and flush.
And then wait
Flush.
for 5 minutes and then you gotta flush it. Well, how do we flush it?
Saline?
Saline solution.
No, you use the red tube.
Oh,
Mm.
sorry, I'm thinking.
So when you do a light
I
blue
know.
tube, the rule is draw red first, so it's the same thing. Instead of light blue, you draw a red first, that's flushing out the saline in that system. Then you draw whatever you need to draw. Once you finish,
What do you draw? Is it on the, not on the IV tube, right?
so they have a vein right here, probably pretty big, and they have an IV right there. They may have a little bit down here that you can draw in the vein, okay? Or if you have, they may have put an IV here, they may have a vein right here in the middle, and they put it in the cephalic. Then you draw on the medium, but because it's the same height, you can't go, you gotta go below basically. Anything that's not below, you gotta turn off the IV, okay? What was my train of thought? Sorry. So you turn off the IV. So the IV's turned off, you've done your tubes, you've drawn your blood. What are you gotta do now? Make sure they turn it back on, right? Yeah, let the nurse know, turn it back on. Okay, so the IV's not plugged in, so I don't need to worry about that. Hi, my name's May, I'm here, I'm your phlebotomist today. I'm gonna draw your blood if it's okay. I'm gonna check your ID. I had some label somewhere, right here. You should have a form. So the form goes in the back pocket, if there is one. If there isn't one yet, but otherwise it goes in the back pocket right here. Okay? Okay, on this form, you don't need to worry about any information except your labels, except your ID. Because you gotta make sure this is the same as this, as the same as this, okay? When you get your form, you're gonna have your labels here. I want you to take them off and make sure you are checking everything. Okay, name is John C. Johna. Date of birth 12/24/1972. MRN is 832-832-673467. You don't have to read this out loud if you don't want to, but if it helps you, you might want to do it. Okay. Okay. Good. This is different.
Yeah, we don't need to ask them ID. We just read.
You just read it because this is blood culture. This is not ABO cross match. Okay. We're doing blood culture right now, so don't get those two mixed up. Okay. But if you want to read out loud, you can, but do it as though you're telling the patient. You're not teaching yourself. Okay. All right. I'm gonna do blood culture.
But you do greet the patient and ask them if you can do a draw.
You can, yes, you do have to greet them, you have to tell them who you are, you've got to get permission. Even if they are unconscious,
Yes.
you still got to do it, because what tells you that they're not hearing you?
Yeah.
Right? And remember, when you do your blood cultures or other tests, there may not be just a blood culture on there. There may be other tests attached to that patient, okay? So I want all the tubes that are for those tests. If you just give me this and no other ones, you'll get points knocked off.
Don't do hard work.
I already done it, I'm sorry.
You good?
Okay, I'm gonna get my stuff set up. This one doesn't have anything in here. Somebody get me a 21 butterfly, please.
Nothing is stocked over there. So you think you're looking. There's only 25?
Yeah, that's fine. I'm assuming he has a massive vein, so. I found, oh, actually, this is not good. Can you
You're
give me
missing
the
the
other
other
one?
part.
Yeah, where's that come from? Yeah, not a good day today. Oh dear.
It's a full
It's a
moon.
full moon.
Oh, is it?
We figured it out.
All right, we're gonna
That
put
tube looks
those
so
in.
short.
Make sure when you do that, because this always comes loose, make
Mhm.
sure it's tight. Because if you don't do it tight, in the middle of your jaw, it's gonna pop off. Okay, things I don't need, I'm gonna throw away. I'm just gonna use the things I need. Where is your supply supposed to be?
On the
On
left.
the. Wait, what
On the left.
do you mean?
Nope.
Oh, you mean like with the
Next
table?
to the
Where's all your
patient.
supplies gonna be?
Oh, on the bed.
Next to the
Next to the
patient.
patient.
Side.
Not by their knee. Right?
Dominant, non-dominant?
Dominant.
Non-dominant.
Non-dominant, right? Your dominant hand is what?
Left.
Needle hand.
Oh, you said dominant. Sorry, I'm getting confused.
So if your dominant hand is your right hand, this is your needle hand. You do everything else with your left.
Left.
So everything else is gotta be on the left side of your patient if I'm right-handed. If you're left-handed, I don't have any lefties in here, but if you're left-handed, it's gonna be the other way around. Okay? Okay, I am gonna check for a vein. How far up is the tourniquet gonna be? 3 to 4 inches above the site, and I've seen you guys really close to the site, 3 to 4 inches. If you don't know what 3 to 4 is, 3 fingers or 4 fingers, okay? This is the wrong one.
Is it not in the kit?
No.
There we go. 30 seconds.
When we do the tourniquet on this one, we're gonna do a little looser because we're gonna be longer than a minute. So we don't have to tie it so tight, just a little looser, okay? Because I've got my needle ready already. You can either alcohol first. How long do I have to do this for? 30 seconds to a minute. Or you can do this one first, which is,
Putting the alcohol swabs on top of
yep. You can either do that first or do that first. It doesn't matter. I'm not gonna dock you for not doing which one first.
Just do it.
You just gotta do it, yes. Okay. When you guys are practicing, don't open these because I don't have any. I wanna keep those. Little poke. When we're drawing our bed, because the patient's lying in the bed, you have to control the way you draw by moving their arm or moving yourself, okay? Because they can't move, not like when they're in a chair. When they're in a chair, you can ask them to move themselves, but they can't. How you doing? Which one goes in first? Aerobic. Okay. And how much do we do?
3 to 10.
What's the minimum?
10.
Minimum.
3.
Maximum?
10.
Okay, so between 3 to 10 millimeters. What you do is you look at where this liquid or this additive goes and you measure up from there. Okay. On these bottles, they don't have a 3 millimeters, they're 5, so it's easy to do 5. I've done my aerobic. What's next?
Anaerobic.
Anaerobic. All right, if I have any other tubes now, I did have one, I'm gonna do that one too. Well, not the blue, because you can, actually yes, because the rule with that one is red, right? But because we've already done this, it takes away the tissue fluid. We don't need the red anymore. You can now pop the blue back in there, right? All right, that's my last two. I've got to
Pull the tourniquet.
untie the tourniquet. Make sure you invert. Okay. Oops. Apply pressure. If they can't apply pressure, you find the best way you can. Okay. Once I've done this, I want to make sure I tidy after myself so I don't forget things, because you cannot leave anything on the bed. Okay, I can go back there. Where's my labels? What happened to my labels?
Were they with your sheet?
The sheets?
With your sheet?
Okay, what do I have to put on here?
Time, date, initials, and the X.
So I'm
The
putting
set. The set. And the location.
sign, date, 15th today,
Yes.
and time. What is the time?
Oh, I cannot see that. 12:40?
Let's say 12:40.
147.
Oh,
1:47. Oh.
Definitely cannot see.
Also, what do you have to put on here?
Time.
The
Time.
the site.
Site. So I drew on his right AC. And
The set.
blood culture times 1. Okay, on
Oh,
both.
BC time. Okay.
R, AC, blood culture times 1, sign, date, time. Also, on here, whatever you put on here, it's got to be on here. So I'm not going to write on this one. Sign, date, time, blood culture times 1, right AC. Okay. If you just have this, you don't have this on here, you get
Lose point.
yes.
That's the point.
Don't put it on the window. Don't put it on the barcode. I don't have enough, but just say I put one on here too.
Same information.
Same information.
But you put the test on that one, right?
The test is going to be different.
Yeah.
But everything else is going to be the same. Except this one does not need to be right AC blood culture.
Yeah.
Just
Okay.
this. Okay. Put everything in there.
Do you
Put my
invert
sheet in.
the blood culture bottles, or you just draw it and put it in the bag?
You got to invert it.
Okay.
Okay. I have everything. You remember you have 5 minutes to do all this. Okay. Back up.
It's 14.
Thank you.